DigiAgeTalk-tilaisuuden avaa Japanista saakka tänne Helsingin kaupungintalolle saapunut professori Takanori Shibata. Shibatan puheenvuoron otsikkona on PARO-hyljerobotin vaikutukset ikääntyneiden fyysiseen, psyykkiseen ja sosiaaliseen hyvinvointiin. Hänen puheenvuoronsa, niin kuin tiedätte, on englanniksi. Mr. Shibata, irashaimase. Welcome on the stage. The stage is yours.
Thank you very much. So, good afternoon, ladies and gentlemen. I'm Takanori Shibata, and as I was introduced, so I'm from Japan. And today I'll talk about PARO. And PARO has been a medical device in Finland and also in Europe since 2021. But even become medical device, PARO has been used as an assistive device in Europe. And now, so let me explain about PARO. So I work for the Japanese Government Research Institute, which is named National Institute of Advanced Industrial Science and Technology. It's called AIST. And also I'm a CTO of a company, Intelligent System, that produce and sell PARO. So there is a slight conflict of interest, but still I try to be very honest. And first, I'll explain about PARO as a psychophysiological biofeedback medical device. And in order to be a medical device, we needed to accumulate and show the clinical evidence, especially by randomized controlled trials and some others. And now we also showed the balance between cost and benefit. And then some countries started to adopt PARO in their healthcare systems. Some countries cover the cost of treatment of biofeedback therapy with PARO by their insurance. Or some countries support the purchase of PARO for elderly facilities or even some hospitals. And so now more and more PAROs has been used for dementia care and even for other patients, like people with cancer, brain injury, Parkinson's disease, like PTSD and so on. And I'll explain about them. And now PARO has been used for Ukrainian refugees in Poland. So after Russia in 2022, a lot of people evacuated from Ukraine, and a lot of people moved to other countries, surrounding countries, and even here, I think. And as for Poland, they had the most. There are about 4 million people who moved to Poland. And there are a lot of children and their mothers and also grandparents. And PARO has been used for healing or improving their anxiety, some symptoms of PTSD and so on. And now we collaborate. In the beginning, we collaborated with medical organizations in Poland. But now the United Nations, IOM, International Migration UN International Migration Organization, and also UNICEF. And so I'll explain them briefly. And also now we are proposing PARO to be a companion for astronauts in space missions, such as mission to Mars. And we have some kind of test of PARO for them on Earth. So depending on time, I may explain about them. I worked for the Japanese government, the cabinet office, and at the time, it was 2009 and 10. And I had a chance to propose a kind of new policy. And at the time, I proposed the assistive development and also introduction of assistive technologies and robot in Japanese government. Then Ministry of Health, Ministry of Economy and Trade and Industry, and some others, they started to develop such kind of technologies. And now they start to introduce them in the practical systems. And I think PARO is one of them. And let me show you a video. I think some of you have already interacted with PARO in this morning. But let me show you a video. So this video was created by the Japanese government. the first portion of the video shows the functions of PARO. PARO has many kinds of sensors, whiskers are sensors, and also whole body is covered by tactile sensors. So PARO responds to your touch, talk, some others. And PARO has warm body temperature control. And this scene shows a lady who has dementia, and also sometimes she has agitation. But when she interacts with PARO, she talks to PARO, and also she keep or improve her good mood, and she can stay in calm. And then caregivers can take care of her much easier. And in the US, this facility was a skilled nursing facility. It's like after discharging the hospital, they move here. And when this kind of facilities purchase PARO, there was a fund. There is a fund by the federal government, which covers the cost, 100% of the cost of the PARO. So they got PARO as free there. Because PARO can reduce a lot of, improve the BPSD and also reduce the dosage of medications. And this person is a former soldiers, like this was taken at the Veterans Hospital. So he had PTSD and also now dementia. And sometimes he has agitation and some behavioral issues. But when he interacts with PARO, or he improves his mood and reduce some negative behaviors, then they don't need to use medications, psychotropic medications. And also, the caregivers can take care of the person very easily. And this picture was at the Karolinska Institute in Sweden. So PARO has been used at the pediatric ICU. And they are Ukrainian refugees in Poland at a psychiatric hospital. They are outpatients. So when they talk about the Ukraine, they have some negative kind of issues. But when they interact with PARO, they improve their mood and reduce anxiety and also symptoms of PTSD. So PARO has been used since 2022 and even now in Poland. So I started to develop PARO since 1993. And so I've been working on this for more than 30 years, before you were born. And so I learned a lot about animal therapy. So animals are very good for human beings. So there are three kinds of benefit from animal to human beings. First, psychological merit. Second is physiological merit. Third is social merit. So animals are very good, as you know. But in the practical use of animals, there are some problems. Some people have allergy. Some people are afraid of bites and scratch. And there is a potential of infection from animal to human beings. And also at apartments, some places do not allow us to have animals. And also at hospitals, nursing homes, and some others, it's very difficult to keep or manage animals there. And animals are very expensive, actually. So for such people and for such places, I thought animal-type robot would be very good if they have therapeutic effect. And the model of the PARO is a baby seal in Canada. And when we talk about pets, most people talk about dogs and cats. But when I started research, I developed a dog robot and cat robot, as well as a seal robot. But when I asked people to evaluate them, in the case of dog and cat robot, in the beginning, they had high expectation. But when they interacted with the robots, they are disappointed because they compared the robots with image of real dogs and cats, and the people became very critical. But in the case of the seal robot, people didn't have high expectation. But after interaction with the seal robot, people had higher value gradually. So people didn't expect too much, and the people accepted the seal robot much easier. Then I started to focus on the seal robot. And also the shape is very good to hold and also put on the lap or next to the person on the sofa. So PARO can be a very good companion for the people.
How you clean it?
So as I will explain about it, but this file consists of silver ion that can kill bacteria and virus. And basically, 2 minutes of cleaning by disposable wipe can keep PARO clean and disinfected. So in the UK, they have National Health Service, and they have hospitals, public hospitals. And they evaluated cleaning protocol for 9 months. And they counted the number of the bacteria by using the ATP device. In the UK, 10 centimeter by 10 centimeter by 10 centimeter area, the number of the bacteria should be less than 30. And if we count the number of the bacteria, like on keyboard or doorknob, there may be hundreds or thousands of the bacteria. But with the cleaning protocol, they kept the numbers less than 30 all days for 9 months. Then the NHS hospitals accepted PARO to be used at the hospitals. And now PARO has been used even at acute care hospitals, ICU, and so on. I'll explain about them a little more. And the current PARO is 9th generation. And PARO has artificial intelligence, especially we call it embodied artificial intelligence. And the PARO's size is 55 centimeters, and its weight is about 2.6 kilograms. It's like human's baby, or like small pet. And PARO has 3 microphones for speech recognition and sound localization. Unfortunately, this PARO recognizes 5 languages, including English, French, German, Italian, and Dutch. Not Finland language. But if you talk to PARO in English, PARO recognizes them. And PARO has 2 light sensors. PARO doesn't have CCD camera because of a privacy issue. And inside, PARO has posture sensor and temperature sensors. And whole body is covered by tactile sensors and whisker sensors too. And as I said, the fur consists of silver ion. And the PARO has 7 actuator systems. And as artificial intelligence, PARO has 2 kinds of learning functions. One is name, the other is behaviors. If you give a new name and call it again and again, PARO gradually learns the name and start to respond to the new name. And if you stroke PARO, PARO feels that's very good. And the PARO tries to be stroked by the owner or users. Then PARO changes its character to be liked by the owner. And if at the facilities, if many people use PARO, or if you give a common name, PARO can learn the common name. But if people stroke PARO, people have different preferences. And in the case of like family or small number of the people, PARO can learn the favorite behaviors. But like 10 people, 20 people, PARO cannot learn all of them. And this is inside. So, but PARO has a lot of technologies, but we hide it inside technologies as much as possible. So PARO has 1 switch to turn on, and this is battery charger, pacifier. That's all. And inside PARO has a volume, so you can change the level of the sound of PARO. But when you use PARO, you don't have to worry about technologies very much. And PARO is not connected to the internet because of the security issue and also privacy issue too. So PARO is very safe and also reliable and robust. Because the average life length of dog is about 14 to 15 years. So I expected people may live with PARO for 10, 15 years, 20 years, even longer. So I designed PARO to be used for many years. Our factory is located in Japan, that's Toyama, and we have very nice nature, as like here, and the ocean, beautiful places, and also historic places too. And in our culture, we have emphasis in the craftsmanship. So we have very old things, and they are like UNESCO World Heritage. And people are still working on this kind of industry, and we learned a lot from them. So PARO is a kind of combination between technology and art. And so each PARO is handmade, and each PARO has a slightly different face from others. So in terms of art, PARO was exhibited at some museums, like Louvre in France, MoMA in New York, Quai Branly in Paris. It's an anthropology museum, Design Museum in London, Victoria and Albert Museum in London too. And they collected PARO. So now PARO is on the list of their collection. It's in Spain, Germany, Norway. And so a lot of people accepted the quality of PARO as like an art. But of course, PARO has been used practically, and now PARO has been used almost 50 countries. About 8,000 units has been used. And half of them are used in Japan. And among them, another half are used by individuals, So people purchase PARO as a pet, especially for senior people. So they are still healthy, but living with PARO is very good. They want to have a dog or cat, but when they become senior, they feel tired to have or keep real dogs. So the PARO can be a second choice for them. And another half are used for therapy at the institutions. And in Europe, Denmark was the first adopter of PARO. They had a national project to evaluate PARO in dementia care from 2006 to 2008 for 2 years. And they found PARO is a very good tool to enhance the skill of the caregivers and the therapists to realize the person-centered care. So they started to adopt PARO. And now more than 90% of the municipalities in Denmark have already adopted PARO. And they expand the usage of PARO not only for elderly people with dementia, but also for the children with developmental disorders, psychiatric problems, and also some other disabilities too. And in the UK, they have medical guidelines. It's called the NICE guideline. And the dementia, there are 5 categories. Dementia is one of them. And they introduced PARO in the NICE guideline as a non-pharmacological therapy for people with dementia. So at the NHS hospitals, of course, they have to have PARO. But if elderly people with dementia have behavioral issues or psychological issues, they have to try to use PARO. And if PARO doesn't work, they are allowed to use the psychotropic medication. So PARO is the first choice in the dementia care in the UK. And in the US, PARO is a biofeedback medical device in class 2 since 2009, earlier than Europe. And we accumulated a lot of clinical evidence by randomized control trial and so on. Then in 2018, the Medicare and Medicaid, they are public medical insurance, and also private medical insurance is started to accept reimbursement of the cost of the treatment by using PARO. So as a medical device, let me explain about the effects of PARO. So interaction with PARO can improve quality of life, anxiety, pain, depression, sleep, stress, loneliness, pleasure, engagement, and so on. And also improve communication and sociability. And because of such kind of effect, we can expect to reduce agitation, aggression, walking about. And also, the people can be with dementia, like neurocognitive disorders, and also other disorders, like developmental disorders. And as people improve their behavioral issues, then we can expect to reduce the risk of falling. PARO can stop wandering. And also reduce burden of care. Then psychotropic medications, like especially PRNs. So these figures, pictures shows the image of PARO in the future by Simpsons. Now I think PARO has been used well. And as I said, in Japan, a lot of people purchase PARO as a pet at home. So the couples use PARO or live with PARO as like living a dog. But they are allowed to bring PARO on the counter of the sushi bar in Japan. But let me focus on the elderly care. So Japan, Germany, Italy, we are one of the most aged countries. But a lot of countries are becoming aged countries, except Africa. And dementia is a very big issue. Now, there are about 55 or 57 million people who are suffering from dementia. And that number is growing. And as for the cost of medical and welfare service, in 2018, it was estimated about $1 trillion US. And in 2030, it will become double. So it's huge cost for our society. So let me show you one video in the case of a person who has Alzheimer's disease and the severe dementia. He has aphasia, so he cannot talk, or he cannot speak. So he's always screaming in that manner. But he likes PARO. Now therapist brought PARO. First, he stopped screaming, then started to talk to PARO. A lot of people recover speech, even if they become aphasia. Both cognitive, especially cognitive reasons. Then he started to express himself, and he explained what is the reason for his anxiety or some problems. And the therapist can understand what is the kind of reasons. Then through communication, the patient improved his mood. Now he had smile. And at the time, the therapist wanted to calm him down in order to take him to lunch. So before lunch, before dinner, before bathing, when they need to calm him down, they use PARO as like switch of the person. But before having PARO, they gave psychotropic medication to this patient. And it takes about 30 minutes to have the effect of the medications. But because of the side effect, there is a risk of falling from a wheelchair in his case. So after giving the medication, the caregiver or someone have to be with the patient. But after starting to use PARO, PARO works only in a few minutes. So it's very short. So it's very easy for the caregivers or therapists to take care of a person who have such kind of behavioral issues. And there is no side effect. Medications have problem of the side effect and the addiction. And next one is the case of wandering or walking about. The lady is walking about. In the evening, so she wants to go back to home. So it's sundown syndrome. But she likes PARO. Now she is looking or watching PARO. And the therapist pick up a PARO from another person. Then the lady start to interact with PARO. It's dark, but she has a very good, nice smile. So through interaction with PARO, she gradually reduced her anxiety, and she improved her mood. Then she doesn't need to go back to home, so she can stay at the table. So interaction with PARO stopped her wandering. So next one is a case of the Parkinson's disease. So when people become Parkinson's disease, they cannot control their body well. They have tremor. So this lady is in the center. She cannot control her body. But with PARO, her legs are slightly moving, but her upper bodies are well controlled. So with the person with Parkinson's disease, with PARO, they tend to control their body well. So that means they have more dopamine, like hormone, in their brain. But there are some other diseases, such as Huntington disease, or even cerebral palsy. They have tremor too. But when they interact with PARO, they stop or reduce the frequency of the tremor. So in Australia, when people are less than 65 years old, and if they have some disabilities, and if they want to purchase PARO, the Australian government supports 100% of the cost of PARO for the people with disability, any kinds of disabilities actually. Not only for cerebral palsy, but also developmental disorders and some others. And this is the recovery of speech. So as like in the first picture, a lot of people recover speech. So these pictures I took them in Denmark. And as for the lady who are interacting with PARO, she was from Eastern Europe and immigrated to Denmark. And before becoming Alzheimer's disease, she spoke 2 languages, so Danish and original language. But after becoming Alzheimer's disease, she couldn't speak Danish, only the original language. But as for the care facility, there was no one who spoke the original language, so she couldn't communicate with others. But when she interacted with PARO, she talked to PARO in Danish. And at that time, she can communicate with others, like caregivers. So caregivers bring PARO when they need to talk with PARO, the lady, in Danish. And I saw the phenomena, so I took these pictures. So while thinking of this phenomena, in her brain, there is a speech engine and 2 dictionaries in her case. But because of the Alzheimer's disease, she couldn't access the original Danish dictionary. But when she interacts with PARO, her brain is stimulated and activated. Then she can access to the Danish dictionary by recovery of connection or through detour. Anyway, she could speak in Danish when she interacted with PARO. But when we remove PARO, she couldn't speak Danish again after the deactivation of the brain. And recently, this paper was published in November 2024, and this was a result of the randomized controlled trial in Taiwan. And PARO was used at the day care center, and the therapist used PARO. There was an intervention. And there are 2 groups, with PARO or with the art therapy, like craft. And people interacted with PARO for 6 weeks. And this is before interaction with PARO. And this one is 6 weeks later. And then they didn't have any intervention for 4 weeks. So this is T3. So as for PARO group, they continue to improve the cognitive levels, like MMSE. But as for the craft group, they decreased the cognitive levels. So interaction with PARO can keep or improve the cognitive levels of the people with mild dementia. And there are other indications that had improvement. And in the US, there was a randomized controlled trial in the case of people with dementia. And there were 61 people with dementia at 5 dementia care units. And they divided into 2 groups, with PARO group and without PARO group. And with PARO group, interacted with PARO for 20 minutes, 3 times a week for 3 months. And as for without PARO group, they had ordinary therapy, like music therapy or some others. But with PARO group, improved anxiety, depression, pain, and stress significantly. And also, they reduced the medications. For example, as for the medication as needed for anxiety, a PARO group reduced 30%. And the PARO's effect continued for 5 hours. That's 2 hours longer than the medication. And in the US, they used a lot of medications, and it cost a lot. But using PARO reduced the cost of the medication, and also side effect. There are many other data. So this is pain med dose. There was a significant reduction. And also behavior med dose too. So there are a lot of reduction of the usage of medication for the people with dementia. And this is a hierarchy of evidence. So there are a lot of research papers or clinical trials. Some are with animals. Some are just case studies. And PARO has been evaluated by randomized controlled trials. And now there are many. So after the systematic review, we can find many papers on the randomized controlled trials. And then we can conduct the meta-analysis of them. Then we can find some kind of results. And this is one of them. But it's already old, like 2019. And they found 980 papers on PARO and some robots for people with dementia. But they found 7 papers on randomized controlled trials, and they are all about PARO. And they conducted the meta-analysis. And the results showed that interaction with PARO improved the behavioral and psychological symptoms of dementia, and also agitation, depression, and also the BPSD. And the PARO had effect both individual session and also group session, like one-on-one therapy, or like one PARO and some people. So in any case, PARO showed the significant improvement. And in Australia, that was the first randomized controlled trial, and it was a small number of the participants. But the PARO showed the improvement of the quality of life and pleasure. And the Lancet Neurology introduced the results. And they say that was the first clinical evidence of animal therapy, any kinds. But the PARO is not really animal, but the PARO is like animal robot. But the PARO was the first to show the clinical evidence. And the Professor Wendy Moore, who is the leader of the project, she got a big fund from the government. And they had a large-scale randomized controlled trial with 415 people. And they showed the kind of improvement of the engagement and also kind of mood, agitation, and so on. Now, in Australia, we have a lot of users in elderly care facilities. So this is another result of a meta-analysis by University of Singapore. And they focused on PARO and dementia in the database. And they found about 900 papers on PARO for elderly with dementia in English. And 12 papers on randomized controlled trial. And they had conducted meta-analysis of them. And they found the interaction with PARO improved the behavior and psychological symptoms of dementia, and also sociability, and also reduced the dosage of medication. So in the US, as I said, PARO can be prescribed for many kinds of patients. Patients with dementia, cancer, PTSD, brain injury, Parkinson's disease, developmental disorders, and so on. And when they are diagnosed with pain, anxiety, depression, insomnia, agitation, and so on, then biofeedback therapy with PARO can be prescribed. And the public medical insurance and private medical insurance accept reimbursement. And the reimbursement is higher payment in the case of PARO. So this is an example of a prescription in the case of the depression. So usage of PARO therapy for 20 minutes, 3 times a week in group session. This is another prescription for insomnia. PARO-seal therapy, biofeedback therapy, 20 minutes one-on-one session before going to bed. And this is the case of the person who have severe dementia, like behavioral issues. So PARO therapy is for 20 minutes twice a day, and PRN when they need to use PARO, like before, like either when they want to calm him down. And PARO can be prescribed for rehabilitation, like for fine motor skill. When people stroke PARO, people naturally move their arms, for example, and they may hold PARO. That's a very good rehabilitation for fine motor skills. Also, a lot of people talk to PARO or sing to PARO, then they talk or speak. Then that's very good for speech therapy, and also good for swallowing. Like people use muscle when people talk to others. And they may hold PARO, they use their muscle at the back. And for example, when people have the problem in swallowing, in Japan, some people have a tube from nose, and some people have a hole at the stomach. But anyway, so they take the gradient in some way. But even for such people, when they start to talk to PARO, they recover the function of swallowing. Some people started to think and talk, then they started to drink their own saliva. Then after 2 months or so, they started to eat jelly food. And then they didn't need a tube from nose. And there is another one randomized controlled trial in the case of the rehabilitation of visuospatial hemineglect in Germany. So when people have stroke, after stroke, people can see left eyes, but they cannot aware or recognize things. That's a kind of a visual spatial hemi-neglect because of the problem in brain. But the interaction with PARO improved the recovery of function as a rehabilitation, comparing with the ordinary treatment. And PARO can be used for cancer patients. And also in the University of Pennsylvania in the US, they used PARO as an acute care hospital for elderly people who have dementia and or delirium. Delirium is a very difficult symptom. There is no medications. But as a result, they found the interaction with PARO improved the agitation in 20 minutes. And also the pain in 60 minutes. So PARO is very useful in acute care. So this was the first day. And they have been using PARO since 2019 at the acute care hospital.
Have you proved it with the animals?
There is no animals allowed to be used at the acute care hospital. Now we are collaborating with the Harvard Medical School, and they are now evaluating PARO in the case of the emergency department. When patients come to the hospital in the emergency department by ambulance or by themselves, so they have to wait about 13 hours in average in order to get their bed. But during the 13 hours, there is no treatment for the patients. So people have pain, anxiety, agitation, and so on. But now at the Harvard Medical School, they are using PARO to improve their conditions. And now we had conducted the pilot study, and now we're preparing the randomized control trial there. But there are some problems in US government, so we are not sure if we can finish it or not, but we are trying to do that. So this is the case of Oxford. Let me skip some slides. So as I said, in the case of the National Health Service in the UK, they use PARO as a first choice. And this is an evaluation of the cleaning protocol. So at the Sussex NHS and the University of Brighton, they put the bacteria on the fur of PARO on purpose, and then cleaned the fur. And 1 minute of cleaning reduced the number of the bacteria, but there are some places which had around 30 bacteria. But after 2 minutes of cleaning, they completely cleaned. And in the case of the COVID-19, 30 seconds are fine. So 2 minutes of cleaning can control or keep PARO clean and disinfect. So we have been collaborating with Imperial College London, and they have been using PARO at the Chelsea and Westminster Hospital in London. And this picture was taken in August 2020. So PARO was used for patient, and he is a medical doctor, so he has personal protective equipment. Because in August 2020, it was the beginning of the COVID pandemic, and the people are not allowed to contact each other, as you remember. So PARO was used for patients in hospitals. And in France, the APHP, the huge medical group around Paris, they evaluated PARO in elderly geriatric service or hospitals. And in 2015, PARO got an award as a patient trophy for innovation of non-pharmacological therapy. And in 2018, the French government stopped using the medications for slowing down the Alzheimer's disease. But there are no ways, no other medications for dementia. So they started to have emphasis in elderly care. And now, when the elderly facilities purchase PARO, the 100% of the cost of PARO are paid by the state governments in France. So we have more and more users in France. And there are a lot of other use of PARO, like for children and some others. It's in Sweden. And PARO has been used for the children with developmental disorders, like Down syndrome, autism, ADHD, and so on. And this is pediatric cancer patients. And this is another pediatric ICU at the University of California, San Francisco. This boy got more than 100 times of the surgery at the brain, but he was hospitalized for 10 years. Like his age is like 11 years at the time. But so PARO was allowed to be used there to improve his mood and reduce anxiety, pain, and so on. Yeah, maybe I have to stop soon. Do I have time? Yeah, so there are some clinical trials in the case of the children with autism. And in Japan, we had many times of huge earthquakes. And there are a lot of people who evacuated from the area to the evacuation shelters. But I brought PARO to the shelters first, and then people were very happy with PARO. They were very depressed, or they felt anxiety, or like some people had PTSD too. And unfortunately, pets are not allowed at the shelters. And so we donated about 80 PAROs in the disaster area in 2011 and 2012. And some are used for at the hospitals, some are at the nursing homes, some are for pediatric services. But these pictures are taken in 2022, like 10 years later. So they are still using PARO. And PARO is the kind of oldest staff at the facility. So some staff are changed, but the PARO continued to be used there. And in 2024, we had another huge earthquake in Japan. And we brought PARO to the evacuation shelters, and they were very happy. And since January this year, a lot of places are remained as damaged by the disaster. But there are some nursing homes and also group homes. Actually, we donated 6 PAROs to 6 facilities, and they have been using PARO. And of course, the elderly people with dementia are very happy with PARO. But as for caregivers, they are also victims of the disasters. So their houses are, some of their houses are broken, and they are now living at the kind of temporary houses. And so they have a lot of stress in their own life, but still they have to take care of others as a job. So, but the PARO improved their conditions too. Maybe. And this is the last portion. And so as I said, there was an invasion from Russia to Ukraine. And other countries supported Ukraine by supporting military activities. But as for Japan, because of the constitution, we cannot provide any weapons to them. So in January and in June 2022, I donated PARO to the Polish medical organizations. And they are very happy with PARO. Some children are with developmental disorders. And there are some more demands. And because of COVID-19, I couldn't visit there in 2022. But in 2023, finally I visited them. And a lot of people continue to interact with PARO. And their mothers are also happy with PARO. And now we collaborate with UNIOM, and they assign or dispatch 8 therapists at the 8 family support centers in Warsaw. And there are about 2,000 refugees there, and the PARO has been used for them. They are very happy with PARO. And also, the UNICEF wanted to use PARO at their Spirit Hubs. That is a day service center for children and their families. And PARO has been used at 7 Spirit Hubs in Poland, in many cities. And at each Spirit Hubs, there seem to be more than 1,000 people who visit and use PARO. And yeah, so I have to stop my talk, but In the case of the space mission, especially mission to Mars, it's a long-term mission. Like one way, it takes about half a year to get to Mars. And the people need to spend there for 2 years. And there is another way to go back to the Earth. And because of the distance, there is time delay in communication. So people are isolated in there, on Earth. So that may cause a lot of risks of human error. I skip some. I have been proposing PARO to be a companion for this project. I mean, the companion since 1997, but I had opportunities to exhibit PARO at space conferences. And people think reducing stress is very important. And I was an invited speaker at the NASA and some others. Sorry, I'll skip many slides. And we had some project on Earth. Like this was in, they are called like analog mission in Utah, Mars Desert Research Station. It's Biosphere 2 in Arizona in the US. And this is important. And the result was introduced at the conference by NASA in February 2024. And it was fun. And one of the researchers was selected as a real astronaut. And we are having some other experiment in Hawaii. Yeah. So this is the end of my talk. Thank you very much. Thank you very much.